Hi everyone. I've been wanting to share some important public health statistics that come from the Centers of Disease Control and Prevention. So some of it I'll have to read because it's pretty dense information. It's not important for you to memorize it. I just want you to get a sense of morbidity and mortality issues and disabling conditions that are impacting so many of the people that we work with. So let me give you first some information from the public health profile within the 10 top public health achievements from about 2001 to 2010. And the first has been just preventable vaccines that discourage or eliminate disease. And that includes things like rotavirus, meningococcal disease, herpes zoster, HPV, diphtheria, and pertussis. And so we've made getting vaccines much more accessible to the population, and that's really making a considerable amount of reduction in actual illnesses. And the other one has to do with prevention and control of infectious diseases throughout the country. And so we've seen almost a 58% reduction in tuberculosis, even though it's coming back into the country mostly by people coming from other countries. And one of the most important one has been HIV and AIDS and trying to reduce that. And we've done a successful job in terms of prevention and intervention, mostly with a drug cocktail. And that also includes screening. Another area has been tobacco control, and public health has taken that model as having been quite good from the 70s through the 80s in terms of reduction of smoking. However, you do see spikes in terms of the amount of people that are smoking periodically, and particularly salient is the teenage population. There's still more to be done in that area in terms of trying to have smoke-free environments, and I know that California leads the country in doing that. The next issue is maternal and child health, or maternal and infant health particularly, and trying to reduce the number of heritable diseases and impairments that infants have, and one of them has been neural tube defects that have to do with improving access to folic acid prior to and during pregnancy. And also we do a great deal of screening now during pregnancy to look for diabetes that will impact cognitive and physical development of children. And we do panels that also look for genetic disorders, and also hearing and audiology tests before the age of 3 months. Now, an area that I think we often forget about, but is a public health area, is motor vehicle safety, and we can all attest to the fact that if you've bought a car in the last 10 years, you know that it's equipped with so much more in terms of crashworthiness and technological devices that even help you park, as well as airbag safety and improve lighting and street surfaces, but it still remains a problem on roadways, and one problem that's salient is stress and road rage. Another area is cardiovascular disease prevention. We've done a great deal of work in trying to prevent heart disease and stroke. However, it still is a major lifestyle impairment, and we really need to improve that. Another one some of you may work in, I haven't, but that's occupational safety and working with people in environments where they have falls, do improper lifting and body mechanics, and trying to reduce the number of claims and injuries. I had a student that used to work for Trader Joe's, and he's now there. He has quite a business he's developed in terms of helping all their staff. The next area would be cancer prevention, and we've done a great deal in improving the rates of mortality for colorectal, breast, and cervical cancer. However, lung cancer remains the leading cause of death. And the next area is childhood lead poisoning. We tend to forget about that, but we've done a tremendous amount in terms of screening children with the pediatrician. However, there are many children that still escape that problem, and they tend to live in older homes that haven't had lead-free paint utilized. So another area that, in lieu of the week that we're looking at, with the tragedy at the Boston Marathon is public health preparedness and response. It's just having all the equipment and surveillance and information in place so that they can respond to something. And one of those things is the idea of bioterrorism, unfortunately. So I hope that you'll keep those things in mind. And now I'd like to just share what are the leading causes of death or mortality from 2011. No surprise, heart disease leads, followed by cancer and lower respiratory diseases that are chronic. That's followed by cerebrovascular accidents and accidents that are unintentional injuries, Alzheimer's disease, diabetes, nephritis, or kidney-related disorders, influenza, pneumonia, and intentional self-harm, and that's suicide. So again, those are within the United States. Now, let's look at what are the leading causes of disability and disabling conditions in this country. And 48 million people in the United States report having a disability, so it's obviously that's keeping us employed. And arthritis, no surprise, is the leading cause. Following arthritis, you have back and spinal problems, heart trouble, mental or emotional problems, and I'm sorry to say I think that's one that we work on the least in all disciplines. Lung or respiratory problems, diabetes, deafness or hearing problems, stiffness, deformity of the limbs or the extremities either by accident or congenital deformity, and followed by blindness or vision problems and stroke. And I was a little bit surprised because I thought stroke would be higher up on the list, but I think you'll find in many parts of the country and around the rest of the world that stroke tends to be more lethal as opposed to disabling. And another thing that I'd like you to think about is that in addition to Public Health Month this April, it's also the Centers for Disease Control and Prevention are making this the month for minority health, and they're making great effort to try to reach out in all areas of public health to populations that are in need, for instance having increased screening tools and clinicians that speak another language such as Spanish. Lastly, I thought it was really important to be able to compare the United States, which is a developed country, with developing countries in terms of leading indicators of death. So let me first start with developing countries. Shockingly, AIDS and HIV still remain the leading cause of death, and here we've made great strides in this country, in other industrialized countries, but that doesn't mean that those same medications and follow-up and screening are available to people in more impoverished countries. And that's followed by respiratory infections, ischemic heart disease, diarrheal diseases, and you don't think about that if you have your own child or someone that you know, but that can be lethal for many young children in a matter of days. Cerebrovascular diseases, childhood diseases, malaria, tuberculosis, COPD, and malaria. So here you see this pattern of communicable and infectious diseases that are highly important in terms of preventing and containing as quickly as possible. Very little in the way of lifestyle diseases, however that's increasing. Now, in the developed countries, or more industrialized countries in Europe and the Americas, you'll see ischemic heart disease is number one, followed by cardiovascular disease, COPD, lower respiratory infections, trachea, bronchial, and lung cancers, road traffic accidents, stomach cancer, hypertensive heart disease, TB, and self-inflicted injury, which is suicide. So you can see a pattern here which have an impact on lifestyle, stress, anxiety, and mental health. So I think this speaks to the fact that we really need to help people control those issues and to have management of nutrition, exercise, and that type of behavior. So I hope you'll think about that. I know you're going to have a little bit less reading this week, and I hope you have a good weekend. Thanks so much. Bye-bye.